So let us start with the few aspects of them. So we'll start with the one case. There are different approaches with which we can get a case, and this is the case which I get only because of this session, last session. There was one student who might be there in this session also. She has asked me, she has asked my opinion in this case, and this was interesting case for me. And in fact, it is not only interesting, but I have to utilize my intellect and I have to show the prescription and tell the prescription. So case from Payal Sandhya, this is the case. She is from advanced course only. So if Payal is there, hi Payal, I want to share your case and I want to tell you the answers, the questions which you have raised at that time, why you have selected such and such remedy. So we'll start with that case only, and it is recent, just 10th of April, that is Hanuman Day, she contacted me. So this is what the case. Good evening sir, I am Payal from advanced course. I need your help in one infant pneumonia case. She has admitted from last 1 month. See, this is very important. She has been admitted from last 1 month. It would be great if anything we can do something. So I have said, can you share the details? And she said yes. So she said, whatever is written as it is, it has been taken from WhatsApp. So what she says, after 3 hours of birth, this baby got frothy discharge from the mouth, having difficulty in breathing with some kind of sounds. That chest depression was there since birth. Doctor took her in ventilator as her SpO2 was 60 to 65. She was having much expectoration, sometime with bleeding also. The color was normal, not dark. After that, she got convulsions also. She had some kind of rash on chest. Now she is on PAP and her SpO2 between 89 to 90. The doctor gave her blood transfusion in between. She had aspirated dirty water during delivery. After that, all these things happened. My drug of choice is Ipecac, but afraid to give, so I consulted you, and that's the case. So this is the case. So you can get such types of cases. You see this baby, just observe. I will show it again. You just go on observing what you observe in this case. So sometimes this is the case. You never get a whole history, you never get anything, but everything is there in order to prescribe. So what you will going to prescribe, what things you will going to consider in these cases, and these are very important, where your intellect, your reading, your knowledge comes into existence. So she had suggested, my suggestion is Ipecac. She is close to similimum but not to exact. Why that I will going to share? Because when you have to understand certain aspects of the case. So we'll just think. So this is the case. What you have observed in the case, that is what is very important. So whatever she has written and what is there in order to come to the similarity, both things are very essential, and those gives the right indication, right prescription, and the result in the patient. So first sentence was in that case was that she is admitted for 1 month and she is not coming out. Still she is gasping for the breath. She has given forced oxygen. So why that happened, that also mentioned over there. So remedy is very clear. It has been mentioned as it is in Allen's notes. If you read the Materia Medica sentence by sentence, every sentence is very important. I will going to teach that. That is what is needed. When we learn the Materia Medica, we learn it just for the purpose of understanding, but we never learn the exactness what is needed. When patient comes, how patient will going to come to you. So remedy There are three remedies which are there for differentiation. The first remedy is the antium tartaricum, Allen's keynotes. We'll learn sentence by sentence. First sentence, there is written asphyxia mechanical. Very important. What is mechanical? As apparent death from drowning. This is what is the case. Finished. This is what is the case. It is not something which has developed, right? Pneumonia has developed after some infection. It is not there. Pneumonia is right from the birth. It is mechanical because the baby has ingested, baby has aspirated the fluid over there. So that is why it is mechanical, and that produces a drowning like future, that from drowning. See, this is what is very important here. It is not a dynamic disease. In fact, it is a mechanical disease which is producing obstruction in the process of respiration. Asphyxia from mucus in the bronchi. There is a lot of mucus in the bronchi. It is full of phlegm. Asphyxia from impending paralysis of the lungs. That infant was going into specifically the paralysis. That's why she was put on ventilator. Ventilator was necessary only for that purpose. Then asphyxia from foreign bodies in the larynx and trachea. There is no foreign body, but here it is foreign body is nothing but the aspirated fluid. And very important feature, with all those things, the drowsiness and coma is one of the important things which is always associated with antium. When I look towards that video, I have looked certain things and which are directly prescribing points. These are the things. Great sleepiness or irresistible inclination to sleep with nearly all complaints like opium and nux moscata. But here the sleepiness is different in antium tart. In nux moscata it is directly different. In opium it is different. In antium tart it is because of this less oxygenation, the drowsiness develops. Child at the birth, the pale, the breathless, gasping, asphyxia neonatal. Word is very specifically used. And what is said, what is explained over there, it relieves the death rattle. In the relations, there was one sentence, and that is what you have to look for in this case. Similar to lycopodium, but the spasmodic action of alley is replaced by the dilated nostrils. Have you seen the video properly? If you have not seen, you can see it in the when that child has become recovered, it was there, but still we can, if you want it, you can find it out. The dilated nostril, it is not fan-like motion of alanasi like lycopodium. In lycopodium, it is just moving like this. In this, it is not like that. In antium tart, it becomes completely dilated, and specifically it is dilated because the child gasps from the breath and it remains as it is. That is the antium tartaricum. That is what you have to observe in this case. Just you can see that video again. Yes, you can see the nostrils over here, they are dilated completely. And even in follow-ups also you can observe the same thing in that case. There is one more paragraph. What he says? Through the pneumogastric nerve. Pneumogastric nerve is the old terminology for the vagus nerve. It is 10th cranial nerve. It is pneumogastric, it has been said, because it acts on the lungs as well as it acts on the stomach. Pneumogastric nerve. It depresses the respiration and circulation. I want to discuss this thing where you will going to learn something, that thus producing the keynote of the remedy. When the patient coughs, there appears to be large collection of mucus in the bronchi. It seems as if much would be expectorated, but nothing comes out. Why there is so much of prattling? Why there is a lot of mucus which is saturated over there? Why it never comes out? Depression of pneumogastric nerve leads to the slow respiration. The moisture which can be thrown away through the expiration, it never happens with the antium tart. And because of which, when it starts saturating, it saturates, gets infected, and more mucus secretion, and patient doesn't have strength, or patient's lungs doesn't have strength to throw them away, and then it gets saturated, infected, and that's why the infective focus is reflected on the tongue of the antium tart patients, and there is a thick milky white coated tongue which is infective term, which you can get in Antim tartaricum. See, the difference between ipecac is also having the action on the pneumogastric nerve. Both are there. But Antim tart, it depresses the pneumogastric nerve. But in case of ipecac, the chief action is on the ramification of pneumogastric nerve, producing spasmodic irritation. It irritates the pneumogastric nerve. And that's why there is a difference between ipecac and Antim tart to develop. Antim tart develops the rattling after 3 days, 4 days, 5 days sometimes, whenever if it is of infective origin, not of a mechanical origin. But in ipecac, it happens all of a sudden, within a day there is a change, and there is also rattling in ipecac because secretions are much more over there in ipecac. And that's why ipecac doesn't have infective focus like Antim tartaricum, and that's why ipecac have a clean tongue associated with it. See the difference, there is a difference. Ipecac child is not so drowsy as Antim tart child is there, or Antim tart infant is there. Ipecac is within a day, extra day everything was fine, and 2 day ipecac child full of phlegm because of the irritation of the pneumogastric nerve. And that's why you never see the infective focus. No drowsy child. In Antim tart it is there. So you have to understand exactly the action of the remedy. My suggestion to all the neophytes are there who are there, one book you never forget to read is the Physiological Materia Medica by William Burt. There the actions of the remedies are very thoroughly explained, on which system that remedy acts and how it acts, how it produces its features. Because original proving is important. Just superficial talking, superficial knowing the remedy is not important. You have to understand the depth, the core, and then you can apply. Third remedy which is having the action on pneumogastric nerve is our Indian tobacco, that is Lobelia inflata. It is also a remedy which has a vasomotor stimulant, increases activity of vegetative processes, spends its force mainly upon the pneumogastric nerve. There also you get the rattling. There also you get the chest and gastric symptoms, but more of a gastric origin, more of a nausea, more of a vomiting in case of Lobelia inflata. But in this case, you can get typically a dilated nostrils, which are not there with the ipecac, which are not there with the Lobelia. And that's why the child is Antim tart. So I have prescribed, I have asked her to go for Antim tart 30 TDS for 1 week. So there are many questions. I know. Physiological Materia Medica by William Burt. Yes, this is the book. Very correct. You have to go for it and you read that book, and when you read it sentence by sentence. That is a good Materia Medica. So question arises, why 30? Why not high or why not low? 30 is the better potency in this case. Not too high because child's susceptibility is comparatively very low. There is a failure to thrive. That is the problem with the child in this case. And repetition is necessary in order to increase the susceptibility, which is already low. You have to increase the susceptibility. Till you increases the susceptibility, till it reaches the normal level, it never works. So I asked her to give the Antim tartaricum in repeated doses and let us see what happens. And homeopathy helps that child. I'm too happy after getting the results. Publication of that book is Bijoins, you can get it with the Bijoin. So this is too important, what you are learning, what you are reading, what you are observing, so your all sounds senses should be there, which are acute enough to catch the situation. And I will share the next slide where you will get the child, where the ventilator was not there, the machine is not there, and child, you can see how the child is. Yes, still abdominal respiration is there, but see the dilated nostrils, you can find it out, the dilated nostril, but child is awake. The generalities are totally improved without any oxygen supply. This is what is the important thing which you have to look for. So this is too important to understand with the cases. So this is one aspect of understanding the case.